I think the conversation on suicide should interest us a lot. But you having said that men, there are more men taking their lives, okay, than women, okay, it's a fact. But then you also need to know that there are actually more women think about or ideate about suicide than men. The men that take their lives are like 3 times more than the women, yet women ideate about suicide much more. The thinking is that women are more open in speaking about how they feel. Even the general health-seeking behavior for women is stronger than men. I think women share more when they are suffering. We run a helpline at our office. On the helpline, the people that interact with the callers tell us that men these days report financial issues. Okay, they're financially constrained. Okay, some have lost their jobs. Remember, we went through COVID. So from that time, there's so many jobs that have disappeared along the way. While on the other hand, the ladies, the most cases, suicide ideation that we hear among women is basically related to relationships. You understand? So what we try to do is to speak to people that the choice they're trying to opt for is maybe not the best in the circumstances, to try and restore hope. You understand? And the conversation should be in giving people more hope than judging them that because they have considered to take their lives, they have committed a crime. And we're saying, for whatever the underlying condition that is making you think that you're better off dead, speak to us. Speak to the professionals, speak to a friend who is next to you. But the other important thing is that even for us as communities, we need to understand that these are normal conversations to have. I think we have key things to do. We as an organization, we have partnered with other organizations. We have a petition in the Constitutional Court. Okay, we have petitioned the Attorney General, okay, to decriminalize suicide or attempted suicide for that matter. So what we can do is maybe to support people within the communities, especially those that have suffered mental health problems, empower them to be able to lead conversations on mental health in the communities. What this would lead to is that those that are suffering will be seeing these that have been or are living with the condition or have been through it. There will be an inspiration for them to try and access care before their conditions escalate, to lead them to even consider what? Suicide. This year alone, we have registered close to 40 cases of people who are calling in, ideating